When I was in high school, my mother was a nurse, so I was always sort of interested in the health professions from the beginning. Wasn't exactly sure that nursing was the path I wanted to choose. And then my father was involved in a motorcycle accident and ended up having an amputation of one of his feet. And I went to physical therapy with him as part of that and just fell in love with the profession at that point. And I started volunteering at that hospital, and again, the more I saw, the more I liked. You know, that relationship you have with your patients and just the ability to make an impact on someone's life. I could use my hands to help people improve. My first goal is to make sure that I have an in-depth knowledge of the programs, their needs, their faculty interests, so I can best represent them to the greater university community, to represent their interests, but also to the external community, the community outside of Shenandoah. My second goal is to help launch the public health program. We're really excited about the MPH program, the Masters in Public Health, as well as a graduate certificate in public health. We're looking at ways to do dual degree programs as well as fast track programs. When I talk to prospective students, there's a number of things that I want them to know about the School of Health Professions. All of our programs, except for the public health program, which is just emerging, are fully accredited. Our faculty is nationally recognized. We are committed to practice here. And I think that does make the Shenandoah experience a little unique. We're able to bring that practice into the classroom. I think the most unique thing about our faculty is their dedication to student success. Our alums, when they come back to Shenandoah, when we interact with them, that's what they say the most, is that the reason that they chose to come here and the reason that they enjoyed their experience here is that relationship with the faculty. It was that environment, and the faculty weren't distant and weren't separate from them. You know, they can view them as colleagues, from the beginning, and really serve as not just educators or disseminators of information, but really served as mentors to those students. In general, I would say that the types of learning that we're doing in the classroom is very different than what we did 10, 15, 20 years ago. Classrooms are much more interactive, and students are doing a lot of group work. We've moved away from sort of your traditional lecture. We've done some simulated activities in our simulation lab. We did a disaster drill. We pulled in students acting students from our conservatory, and they pretended that they were the victims, and it really was just an awesome experience. Those are the types of things that we want to do simulated, so that if they would ever encounter such an event as a practitioner, that they would be able to respond appropriately. One of the best things that I think we've done for years is we have a number of mission trips that take interprofessional teams of students. I've had the opportunity to go to Nicaragua, for example, and it's just really fun to see the students, learning what each other's roles are, building on each other's strengths, to have the best outcome for the patient. The future is very bright for the School of Health Professions. We have people that are really excited and poised to do just some new, exciting, and creative things.